Hi, I'm Dr. Julia King. I'm a psychologist and a yoga teacher, and I have an integrated mind-body approach to therapy. I love working with people with anxiety. So that might mean feelings of overwhelm, feelings of worry, feelings of feeling stressed out or overworked. I love working with people with social anxiety who are really uncomfortable in social situations. I love working with people who have health anxiety, and I also really enjoy working with people who are struggling with panic attacks. So I tend to work with clients from two main perspectives. There's lots of other cool things we can do, but the first one, it would be mindfulness-based interventions. The idea being that the present moment is the only moment that you actually have, and a lot of times my clients have anxiety that is limiting them from doing what they want to do, living the way they want to live, and a lot of that is because they're in their head somewhere else and not actually plugged into the moment that they're living in right now. The second way that I love to work with clients is from a cognitive behavioral approach. And that sounds a little bit technical or formal, but basically all it means is that we want to look at the way that you think and the way that you behave in response to the way that you feel. So your thinking is hugely powerful to impact the way that you feel. And then in response to the way that you feel, you engage in a behavior. And sometimes those behaviors, the things that you're doing to make yourself feel better, actually make you feel worse. So what we want to do is target the way that you're thinking, checking out the things that you're thinking that might not actually be true, the things that you're worrying about where everything's actually okay, but in your mind you think it's not, and the things that you're doing to make yourself feel better, that actually make you feel worse. We want to target both of those things to change the way that you feel. I'm an active, practical, skills-based therapist. So I love to be able to give you skills and strategies that you can use to affect real change in your actual life. So if I only have you an hour a week or an hour every other week, we want to use that time in session. And then I also want to use all the other hours that you have between sessions. You want to be able to take what we're learning in session and take out into the world for you to actually practice those things. So there's lots of worksheets and homework and practical skills and strategies for you to make positive changes in your life outside of session. I have so many clients who recognize through going through therapy that the way that they've been feeling, this anxious feeling, this overwhelmed feeling, is not natural, that they actually don't have to feel that way. They glorify being productive and being busy. So many of us do that in our day-to-day lives in our culture. And to recognize that you have some power over the way that you feel, and regardless of your external circumstances, you can change the way that you think and feel and behave is really, really empowering. So many clients come to me feeling like this anxious overwhelm is just a normal way of being. And once they start to make some progress in therapy, they realize that they don't have to feel that way all the time. And it's so freeing and it's so empowering for them to realize that they can affect change in the way that they feel. And it's wonderful to watch. So I would hope that if this approach resonates with you and this sounds like a way that you would like to approach working on what you're struggling with, to please reach out and give me a call. I'd love to hear from you.